Something is happening inside your body right now. You can't see it. You can't feel it clearly. But it's getting worse every single day. Your blood pressure is rising. 150, 160, maybe even higher. You take your medication. You follow your doctor's advice. And still, nothing changes. But here's the part no one is asking you. Why do your legs cramp at night? Why do you wake up at 3 a.m. with your heart racing? Why does exhaustion hit you in the middle of the day? These are not random symptoms. They are warning signs. And if you ignore them, your heart, your brain, your future will pay the price. I'm Dr. Lauren Hayes. For over 20 years, I've treated patients with high blood pressure that just wouldn't go down. They took more pills, higher doses, stronger medications, but nothing solved the real problem. Until I discovered something shocking. A simple nutrient deficiency. One that over 70% of my patients had. And no one ever checked. When we fixed it, their blood pressure didn't just improve. It dropped. Dramatically. And in many cases, we removed medications completely. Richard did what most people do. He heard magnesium might help. So he went to the store and bought the cheapest bottle he could find. Magnesium oxide. He took it every morning. Week 1, nothing. Week 2, nothing changed. But something else happened. Constant diarrhea, discomfort, embarrassment. By week 3, he gave up. This doesn't work, he said. So he stopped. And his doctor added another medication. More pills. More side effects. Same problem. Richard didn't fail. He just took the wrong form. Susan made a different choice. Instead of guessing, she got tested. Not the standard test. The one that actually shows deficiency. Her result was low. Severely low. She started the right form. Magnesium glycinate. Week 1, nothing. Week 2, still nothing. She almost gave up. But then, week 3, no leg cramps. For the first time in years. Week 4, her blood pressure dropped. 8 points. She kept going. Week 8, lower. Week 12, even better. Months later, her numbers were stable. She reduced her medication, then removed another. Same problem. Same store. Different result? Because she had the right information. Think of your blood vessels like a garden hose. When it's open, water flows easily. Pressure stays low. But when it's squeezed, everything changes. Pressure builds. Flow becomes restricted. Your body works the same way. Magnesium keeps your vessels relaxed, flexible, open. But when you're deficient, those vessels tighten. They harden. Your heart has to push harder. And your blood pressure rises, not because your body is broken, but because it's missing something essential. Here's the part most people never realize. You are losing magnesium every single day. Stress drains it. Medications flush it out. Sugar pulls it away. Alcohol strips it down. And as you age, your body holds on to less and less. That's why so many people over 60 feel tired, sleep poorly, and struggle with rising blood pressure. It's not random. It's depletion. If this sounds like you, just type 1 in the comments. Because recognizing the problem is the first step to fixing it. Now here's the biggest mistake. Most doctors check magnesium, but they check the wrong thing. They test your blood, and your results come back normal. So they tell you, you're fine. But that's not the truth. Only 1% of your magnesium is in your blood. The other 99% is inside your cells. Your body will protect that blood level, even if your cells are starving. So your test looks normal, while your body is actually deficient. The test that matters is different. It measures what's inside your cells. That's where the real story is. This isn't just theory. It's backed by real research. Large clinical studies show magnesium can lower blood pressure. Not slightly, but meaningfully. On average, people see a drop of 4 to 5 points. But if you're truly deficient, the results can be much bigger. 15 points, 20 points, even more. And the best part? You're not forcing your body with drugs. You're simply giving it what it has been missing all along. Now, this is why most people fail. They take magnesium, but nothing happens. Because the form is wrong. Magnesium oxide is cheap, easy to find, but your body absorbs almost none of it. The rest stays in your gut, causing diarrhea. So you quit, thinking it doesn't work. But the truth is, you never actually absorbed it. The right forms are different. Glycinate, taurate, forms your body can use. When you take the right one, everything changes. Absorption improves, symptoms fade, and your blood pressure finally starts to drop. So what should you actually do? Start simple. Choose the right form. Magnesium glycinate, or taurate. Take 400 to 600 milligrams per day. But don't take it all at once. Split the dose, morning and evening. Be consistent, not for a few days, but for weeks. Your body needs time to rebuild what's been depleted. This is not a quick fix. It's a correction. And when your levels come back, your blood pressure will follow. But there's something very important you need to understand. When magnesium starts working, your blood pressure will drop. And if you're already on medication, that can become too much. Some people begin to feel dizzy, lightheaded when they stand up, weak for no clear reason. This is not a bad sign. It means your body is improving. But now, your medication may be too strong. That's why monitoring is critical. Check your blood pressure at home, every morning, every evening. Track the numbers. If they start dropping below normal, you need to talk to your doctor, not to stop everything, but to adjust safely. Because the goal isn't just lower numbers. The goal is balance, less medication, fewer side effects, better control, done the right way. This can change everything. Here's your simple plan. Step 1, get the right magnesium. Step 2, take it daily, consistently. Step 3, track your blood pressure at home. Step 4, give it at least 12 weeks. Not 2 weeks. Not 5 days. Real change takes time. Step 5, pay attention to your body. Better sleep. Fewer cramps. More stable energy. These are early signs that it's working. And if you want certainty, ask for the right test. Not standard blood magnesium, but cellular level testing. Because once you see the truth, you'll understand why this works. Now you have the information. Most people don't. And that's why they stay stuck. More medication. More side effects. No real solution. But you're different now. You know what to look for. You know what to fix. So here's what I want you to do. Start today. And when you come back, I want you to tell me your results. Did your blood pressure drop? Did your sleep improve? Comment "started" below. If you're taking action today, because the people who act are the ones who change their future.